Several countries are already starting to treat corona similar to ordinary flu. Spain in particular now considers this step necessary, but in contrast to Germany, where I am sitting, the country has an advantage. More people are currently being infected with the coronavirus in Europe than ever before. Nevertheless, some countries have started to treat COVID-19 like other endemic diseases similar to the flu, and most notably Spain. However, the WHO, the World Health Organization, warns. According to them, it is still too early for this approach. The left-leaning Spanish government is working to classify COVID as an endemic disease with seasonal outbreaks that people can live with and that do not overwhelm the health system. This step is timely and necessary, says Health Minister Carolina Darias. The conditions for such a change in strategy are better in Spain than here in Germany because 95% of the population over the age of 12 are fully vaccinated in the southern European country. This is one of the highest vaccination rates in the world. And despite records in new infections due to the Omicron wave, fewer people are dying than with previous variants of the virus, and hospital admissions are falling. Some countries are already easing restrictions and shortening isolation times. As COVID becomes endemic, we need to replace legal rules with advice and recommendations, British Prime Minister Boris Johnson said last Wednesday, and he was announcing that most corona measures would soon be lifted. We have to learn to live with COVID, British Health Secretary Sajid Javid argued earlier this year. But they don't have the vaccination rates Spain does. But the pandemic is far from over, warns WHO Chief Tedros Adhanom Ghebreyesus. New virus variants could always appear. Diseases or pathogens are described as endemic if they occur permanently and frequently in a limited region or in parts of the population. However, endemic does not mean that the disease is harmless, clarifies WHO Director for Emergency Aid Michael Ryan. This is made clear by the example of malaria, which is endemic in many regions. Fernando Garcia, a researcher at Spain's National Center for Epidemiology, warns that the debate about COVID as an endemic disease raises false hopes. He says, "We are indeed moving towards the virus becoming more endemic, but we cannot say that we have reached that state yet." And that was also said by Marco Cavaleri of the European Medicines Agency, the EMA. When this point is reached, it cannot be pinned down to a specific number of cases. German Federal Health Minister Karl Lauterbach also assumes that COVID will eventually become endemic. For him, however, this is one more reason to push ahead with protective measures such as general vaccination. If everything goes well and we manage to close the vaccination gaps with compulsory vaccination, we can go into an endemic situation this year, he said in a newspaper interview at the beginning of January. If the coronavirus becomes truly endemic, most people will have mild symptoms and few will die from complications, says epidemiologist Garcia. In such a situation, it will never happen that a quarter of the beds in intensive care units are occupied by COVID patients, not even 5%. More than 23% of the intensive care beds in Spain are currently occupied by corona patients. Nevertheless, some doctors in Spain also support the government's course. Let's stop testing healthy people with mild symptoms. Let's stop tracing their contacts. Let's stop isolation and quarantine, says the Spanish Medical Association, SEM-FYC, for example, which represents 19,000 general practitioners. All these measures have become meaningless with acquired immunity, both through infection and vaccination, and the arrival of Omicron. And I think there's still a large dispute about that one, but we will have to see how it will end up in Spain, or if they have to return to lockdowns. We will see. I'll see you in my next video. Bis gleich.